Hello friends, I am Dr. Pawan Rawal. I am Unit Head Gastroenterology, Artemis Hospital, Gurgaon. Today we'll talk something about inflammatory bowel disease. As the name suggests, there is inflammation in the bowel in this disease. There are two types of inflammatory bowel disease. One is ulcerative colitis and second is Crohn's disease. There are very minor differences. In ulcerative colitis, there is inflammation dominantly in the colon, that's your large bowel, and dominantly it involves the inner small layer. Whereas in Crohn's disease, the inflammation can happen from mouth to anus anywhere. That may be in the small intestine, large intestine, and sometime in the stomach as well. Though the dominant area of involvement is the junction of small and large intestine. In Crohn's disease, the inflammation is more deeper as well. Now, let's talk of the possible causes, why it happens, and what are the symptoms. The cause of inflammatory bowel disease is still not known. People are not certain why it happens. There have been some possible hypotheses given, wherein it has been pointed that in a genetically predisposed individual, it can happen because of immunity induced by certain infections or some unknown insects. But ultimately, it leads to an inflammation, which is a self-amplified inflammation and involves the mucosa of the intestines. What are usual symptoms? Patients usually present with the long history of loose motions, blood in the stools, they can have pain in abdomen, and all this can lead to malabsorption, malnutrition, and weight loss. If we talk of ulcerative colitis, the dominant symptom would be loose motion with blood in the stool. Pain will be more dominant symptom in Crohn's disease, as would be the weight loss. Now, we think that somebody has symptoms for longest duration of time, which are like these as we discussed, one should preferably see a doctor, because these symptoms are usually not because of infections and antibiotics may not work. In that kind of scenario, person would require examination, history, and certain tests. Your doctor may do a colonoscopy, that is the examination of your colon, that means your large intestine. He or she may perform certain blood tests, and sometimes he may do the CT scan of the abdomen as well. Once the disease is diagnosed, most of the time the treatment is medical. Early detection helps. Suppose you leave the disease for longer duration of time and it is not detected, it may lead to certain complications. Complication of inflammatory bowel disease can be because of the disease itself, like it's a disease which is causing diarrhea, it is a disease which is leading to loose motions, bleeding, so person can have malnutrition. Things will not be absorbed and the deficiency of the nutrients would be there and weight loss can happen. Because the person is losing blood in ulcerative colitis dominantly, person may have anemia, that is the lack of hemoglobin. If the inflammation is very severe, it can lead to the dilatation of the colon. Colon is again your large intestine and the term is called as toxic megacolon. Now this toxic megacolon can be further complicated by perforation. That means your intestine can rupture and that actually is a real emergency and may require surgery, that too on an urgent basis. Inflammatory bowel disease having a possible immune hypothesis, so there is sometimes the involvement of organs other than the intestine. Like there has been no involvement of the large intestine as I said, but then involvement of the joints also may happen. There have been people where there have been the arthralgias, like the pain in the joints, that may happen. There can be involvement of the eyes in some people. Sometimes there is involvement of gallbladder. Increased incidence of a situation called as primary sclerosing cholangitis, which is the inflammation of your biliary tree, leading to jaundice sometimes. Very rarely there has been report of where colon cancer was found more common in ulcerative colitis patients as compared to the normal population. So if the duration of the ulcerative colitis in you increases, some people may develop this. So these people should be regularly screened with colonoscopy for the presence or absence of the colon cancer. Now, treatment is available. As I said, it depends upon the type of disease, whether it's ulcerative colitis or Crohn's disease, the manifestations, and the presence of complications. It will also depend whether the person is presented acutely, that means there is history of increased frequency of motion and diarrhea to the number of 10 to 15 and a lot of bleeding. That's the acute kind of situation. Or there is a chronic situation where the person has frequency of 3, 4, 5 a day with bleeding, pain abdomen, malnutrition and other complications. Once the person is presenting in an acute situation, he or she may require hospitalization. Depending on the severity, doctor has to decide. The treatment is given in the form of some medicines. One of the group is called as the mesalamine group of drugs. If person doesn't respond to treatment, the doctor may escalate the treatment to steroids sometime, and further some medication can be given depending on the severity. Very rarely, the urgent surgery has to be performed if person is not responding to the medical management or some complication like toxic megacolon or perforation happens. If there is a chronic situation and person is not requiring hospitalization, by rule it's a medical management. There is an escalating pyramid where the doctor would start the treatment with the mesalamine group of drugs. Occasionally the patient may require the interim doses of steroids just to take care of the flare of the disease. If person is not responding to the above medications, the other group of medication like azathioprine or 6-MP, which is another medicine, can be given. Very rarely, few of the persons may go to further upfront treatment, that is the biological therapy, or the final is surgery. Surgery is more commonly performed in ulcerative colitis because of the limited involvement of the colon, that is large intestine, as compared to Crohn's disease, where the involvement is more diffuse and it may involve small bowel and large bowel as well. So I would advise to my viewers that if the symptoms of loose motions, bleeding, pain abdomen, they are continuing for longish duration of time, maybe more than 15 days or 1 month or even more, don't ignore them. Try and visit your doctor. Assess yourself, let him diagnose. If you are found to be having IBD, don't panic. There is medical treatment in most of the cases. There is escalating treatment as we discussed. Take care of your diet, take care of lifestyle, do regular exercises. Nutrition helps. Prevention as such is difficult because of the poor hypothesis for the cause, so we don't know why it happens. But yes, one can maintain a good quality of life by going for a healthy lifestyle, good eating habits, adhering to the treatment, regular visits to the doctor, maybe giving importance to the new symptoms, and routine screening by the colonoscopy. Thank you.